He had consumed significant alcohol in his 20s and 30s, but he had stopped drinking years before the cognitive decline became prominent. So alcohol alone did not fully explain what was happening. Stage 5. The turning point was a lab test. His ferritin level was extremely high. After a cognitive assessment, he was advised to return to primary care for further testing. The results came back. Ferritin was as high as 2,300. Genetic testing indicated he was HFE C282Y homozygous. That led to a diagnosis: Hereditary Hemochromatosis, HH, an inherited condition in which the body absorbs too much iron and gradually stores it in organs. In simple terms, the body's iron breaking system fails and iron slowly accumulates until storage is overwhelmed. When iron overload affects multiple systems, fatigue, joint pain, sexual dysfunction, and even cognitive or psychiatric changes become easier to understand. Stage 6. The treatment can sound dramatic, but it became a turning point. He began therapeutic phlebotomy, regular blood removal to reduce excess iron. The plan was weekly sessions. The goal was to bring ferritin below 50, then monitor and maintain as needed. He also started testosterone injections, and his sexual function improved. Stage 7. More than a year later, he described a change that was both painful and relieving. At about 14 months, his ferritin had fallen to around 35, and he entered a maintenance phase. More importantly, his mental clarity improved. He said he hadn't realized how severe things had become. He described the earlier period as total confusion, and the treatment phase as if the fog had lifted. On follow-up testing, some measures also improved, especially aspects of visual memory and verbal fluency. That aligned with what the family had noticed: word-finding difficulty, interrupted speech, and a pervasive sense of confusion. So when should iron overload enter the differential? Most fatigue and forgetfulness do not mean HHH. But if you or a family member has the following combinations, it's worth discussing iron studies with a clinician. Persistent fatigue plus joint pain, sexual dysfunction or endocrine-related symptoms plus abnormal liver tests, fatty liver, or unexplained elevated ferritin.